Oropharyngeal dysphagia is highly prevalent in institutionalized older adults, with estimated rates of more than 50% of the patients of the residents, as reported in a 2002 study conducted in Sweden, but involving patients in nursing home and clinics across Germany, France, Spain, and the UK. Similarly, a prospective multicenter study in Spain, conducted between 2011 and 2013, found that nearly 70% of nursing home residents presented with clinical signs of dysphagia. Although the prevalence ranges in a huge range in different studies, we could say that in general, 1 in 2 residents in nursing home might suffer from dysphagia. And we know that oropharyngeal dysphagia is related to a higher rate of malnutrition. A 2015 cross-sectional study carried out in frail older adults with dysphagia or suspected dysphagia reported a prevalence of malnutrition of 45%, with further 44% of patients being at risk of malnutrition. So we can say that 1 in 2 nursing home residents have oropharyngeal dysphagia, and 1 in 2 of those ones with dysphagia had dysphagia-related malnutrition. The European Society for Dysphagia and the European Society of Clinical Nutrition and Metabolism have performed guidelines, and in their guidelines they have supported the use of modified texture in people with chronic dysphagia to enhance nutritional status, with grade of recommendation B and strong consensus. A systematic review and evidence-based recommendations on texture modified foods and thickened liquids for adults with oropharyngeal dysphagia, published by Beck in 2018, concluded that it is good clinical practice to offer different levels of texture modified foods adapted to the individual abilities of adults with oropharyngeal dysphagia. So changing the texture of solid food together with increasing liquid viscosity to achieve bolus modification is still the main approach in the nutritional management of patients with oropharyngeal dysphagia. Say that the main challenges in these patients who live in nursing homes might be related to 3 different topics: the nursing home staff, the diet, and the care quality. Regarding staffing, a lack of resources often translates into insufficient levels of staffing in the nursing home setting, and the inability to form a multidisciplinary team to prepare and perform appropriate nutritional care plans and monitor nutrition and hydration statuses. Currently, a knowledge gap often exists among nursing home staff regarding residents' nutrition and hydration needs, about the screening and monitoring of oropharyngeal dysphagia and malnutrition, about the preparation and the use of texture-modified diets, and how to address eating challenges. Regarding diet, texture-modified diets provided for nursing home residents, when they are not well prepared, may be lower in some key nutrients than regular diets. So should be very careful when preparing this kind of diets. And regarding care quality, insufficient knowledge of the nursing home staff and training of care providers within the nursing home care environment to support the accurate assessment of dysphagia and malnutrition is of paramount importance. And also it is difficult to meet the resident dietary preferences with their eating needs in a communal dining environment. Well, I have said before, texture-modified diets provided for nursing home residents, when not well prepared, may be lower in key nutrients. Adequate protein, fiber, liquid, and some micronutrients, for example, vitamin D, K, and E, folate, magnesium, calcium, potassium, and zinc, are the most difficult nutrients to achieve. And a nutrient-poor diet poses a risk factor for infections, and insufficient liquid intake may also lead to dehydration, which in turn may affect the degree of responsiveness and also the functioning of the oropharyngeal tract. As far as I know, for the first time, a group of experts have reviewed evidence-based knowledge and also reflected about nutritional challenges in the care of nursing home residents with oropharyngeal dysphagia. Due to insufficient resources and inadequate staff training, there is sometimes a suboptimal approach to nutrition, hydration, and dysphagia care in nursing homes. So in this context, the aim of this paper was to present an expert-reviewed report on evidence-based optimal practice and positions on the nutritional management of dysphagia, where this evidence is available, and a collective opinion on better practices to manage dysphagia in nursing home residents, where empirical evidence was absent. And this paper has a specific focus on the role of texture-modified diets and on unmet needs that should be addressed in several areas of care and research concerning oropharyngeal dysphagia.